ARCHway ignites hope through sharing stories of hope. So I'm excited tonight to announce our keynote speaker. Colton Baker is a person in long-term recovery, and he is a certified peer specialist. As a peer, he wears many hats. So he works as an advocate for hope with ARCHway. He's the lead EPICC Recovery Coach through Comtrea. He does community education for Prevent Ed, and he is an executive member of MoPros. In these roles, Colton works to diminish the stigma around the disease of addiction and to close the gaps in care for those impacted by substance use and co-occurring mental health disorders. He does this through communication with a variety of stakeholders and through developing and implementing recovery resources for those in need. Colton shares his story in order to connect with his fellow peers and in order to guide them toward long-term recovery. He is a true advocate for hope for those he works with, and he's here tonight to tell you all about it.
Good evening, everybody. I am grateful to be here with you guys tonight to be able to share my recovery story with you. But I think first it's important that I discuss my experiences with substance use and mental health for a number of reasons, but to normalize conversations around struggling with substance use and mental health, as well as to normalize the conversations about struggling, about needing help, and about, bringing in loved ones and support systems to really help you get better. My experiences with substance use began as an early teenager through social settings, but I quickly realized that I could use substances like alcohol and marijuana to help treat the mental health symptoms I was struggling with. I struggled with depression from an early age. I struggled with pretty severe OCD from an early age and realized that, when I was drinking or when I was using marijuana, it tamped down those symptoms. Unbeknownst to me, I was using really unhealthy coping mechanisms to try to treat the mental health symptoms I was struggling with. That's why it's so important that organizations like Prevent Ed facilitate these prevention programs for young people to, one, reduce the stigma surrounding mental health, but two, to provide access points for young people to receive help. When I was struggling, I felt misunderstood, I felt isolated, and felt like nobody really understood what I was going through, and therefore those people could not help me. Even though I had family members, friends, community organizations that were there, ready and willing, I didn't know that recovery from mental health and substance use was possible. As I got older, my substance use progressed pretty rapidly. I moved from alcohol and marijuana into harder substances like cocaine and opiates. And once I was introduced to opiates, my substance use progressed rapidly and devolved to a pretty unhealthy state. Once I experienced the psychological addiction to opiates as well as the physical dependence and the physical tolerance, I didn't see a way out. I did not see a hope for the future or really a way to get better. It wasn't until family members and friends really sat me down and spoke about how my substance use was impacting them negatively for me to take an inward look and really realize that, I was not getting the results out of life that I was seeking. Substance use was no longer alleviating mental health symptoms, it was making them worse, and I just was not I was not who I wanted to be, and I was not getting the results out of life that I was looking for. So I went to treatment. I tried to get help. First time I accessed treatment was in 2012 at Centerpoint Hospital, where I was introduced to a lot of recovery access points that I had never seen before, whether it be medication-assisted treatment, access to cognitive behavioral therapy, and a number of other community support organizations to help people struggling. Unfortunately, my first go at recovery did not last for very long. Once I was discharged, I went back to using substances up to and including opioids pretty rapidly. It was not until 2014 that I engaged in recovery for the second time. I engaged in recovery for a second time after I had a motor vehicle accident brought on by a seizure from withdrawal from opiates and benzodiazepines, which was a real eye-opener to myself and, led the support system that I had, family members and friends, to really push for me to, engage in the recovery process for a second time. The second time of engaging in recovery really opened my eyes and really put me on a path to lead me to be standing here talking to you guys today. In 2014, I went to the Assisted Recovery Centers of America. While I was there, I was introduced to really the three most impactful treatment modalities that I had seen thus far. First being medication-assisted treatment, the second being recovery housing, and the third being certified peer specialists. Through my stay at ARCHway, I was prescribed buprenorphine to alleviate my withdrawal symptoms and help stabilize me physically. Throughout my stay at ARCHway, I was tapered off of buprenorphine and I was introduced to Vivitrol. Vivitrol is a long-acting suspended injection of naltrexone that lasts for roughly 28 days. Vivitrol, for the first time, provided a healthy mindset of, I can't use today, I can't use tomorrow. What steps can I take to further my recovery, to better my situation, and really put me in a position for success? Vivitrol addressed my cravings for opioids, it addressed my cravings for alcohol, and just really provided that added layer of security that I needed to really engage in the recovery process. The other thing I was introduced to throughout my stay at ARCHway was recovery housing. The peer support specialists that were working there suggested, hey, why don't you come down, check out the recovery house, we're managers there, we can support you through this process. So I did. I went to recovery house and I was plunged into an immediate healthy social support network with other people who are in recovery, who are going through the same problems that I was going through, but also had experience in the solutions to those, healthy outlets for coping, addressing substance use, mental health, and just modeled recovery in a way that for the first time it appeared obtainable, it appeared attractive, and really gave me the confidence to say, I can do this. I can do this. The peer support specialists that were working at ARCHway, that were managing Recovery House at that time, had a major impact on my recovery story, as well as what's led me to be here speaking to you guys tonight. It highlighted the effectiveness that peers have in recovery, their effectiveness in housing, as well as the community organizations that support people through the recovery process. It became very evident to me that that is something that I wanted to do, something that I could not think of a better way to give back what had been freely given to me. As my journey in recovery progressed, I was still engaged in medication-assisted treatment, and I was put in a position to take a management role at Recovery House. Now, that role was not a paid position, but at the time, it was one of the most impactful responsibilities that had been given to me up until that point, because I know the impact that those guys had on me. And I wanted to be able to give that back to the next guy in line, to another person that was needing help. Through connection at Recovery House, the ARCHway Institute, and ARCHway, I got certified as a peer specialist, and I got a job in the treatment field. Through that first job, I was groomed in a clinical setting and really learned how to provide direct services to individuals who are struggling. Peers play a very unique role in the treatment field. They're the connectors between treatment agencies, between housing agencies, between medication providers. And without the help of peers and organizations like ARCHway, people are not getting it. People are not getting plugged in to the resources that they need. One, because they don't know how to navigate the field, or two, they don't even know what resources are available. And that's two examples where peer support specialists and the ARCHway Institute play critical roles to really provide that access and guide individuals, through that process. ARCHway is a connector between treatment, housing, RCOs, community stakeholders, and we work really hard to connect those stakeholders and provide access to care for people who are struggling. But this work cannot be done alone. We cannot fight the addiction epidemic by ourselves. And that's why the community, agencies and stakeholders that we partner with play such a vital role in ARCHway's ability to give back. I was super fortunate when I was in the hospital to have family members and friends that were willing to help me out and plug me in. But if they hadn't shown up at the hospital, if they hadn't called the treatment providers and had $500 to get me in the door, a lot of times the difference between recovery and death is like $500. That's why it's important to support organizations like ARCHway, to donate tonight, to be able to provide that access to care for someone like me, right? These are not nameless, faceless individuals. These are people in our community, your family members, your friends that need that access to care. As a certified peer specialist with EPICC, with the ARCHway Institute, with the MoPros Coalition, and being able to work with organizations like PreventEd and SLU, it's given me the opportunity to provide, life-saving access to care to hundreds of people, right? Which leads me to say, peers in all stages of treatment are critical, right? Through the EPICC Outreach Project, peers provide 24/7 response to emergency departments, behavioral health centers, medical floors. And the reason we use peers through EPICC is because you have a very small window of time to engage a person in that moment of clarity and their willingness to seek treatment resources. But throughout the continuum of their recovery journey, peers can guide them through receiving care, through access to treatment, and then through retention in treatment and connection to community organizations. People do not get better in a silo. It takes a community, it takes a recovery community to help them get better. And so peers throughout that continuum of care really provide the access and the retention and the support to really get better. One of the things I feel passionately about is the sustainability of the peer movement. I know the inherent value that peers bring to the treatment teams that they're a part of, to the outreach programs that they facilitate, and to the long-term recovery of the people that they serve. But peers in recovery are not the only form of support, right? There's peers for caregivers. And that's what leads me to talk about ARCHway's Advocates for Hope in the form of individuals in recovery from substance use, but also, peers for caregivers who have loved ones struggling with addiction. Sometimes it takes another caregiver supporting caregivers to really guide them through support, through boundaries, and how to access care. It's important that our peers in recovery, as well as our caregivers, share their recovery stories and their ability to give back and help others, to diminish the stigma associated with substance use, mental health, and seeking treatment, to provide education and to help people heal. The ripple effect that the ARCHway Institute has had, that the peer support specialists that we worked with have, is marked, right? When you help one person get better, it affects their family, their loved ones, the people that they work with, and just giving back to one person has an incredibly valuable impact on the communities that we live in. So I encourage all of you to donate tonight to support the ARCHway Institute. I am so grateful to be able to be here and share my recovery journey with you. Thank you, guys.